Let's see. Do I need to move this? Or does somebody else? Okay. There we go. Osio Toheju. I am Beverly Patchell, and I am Saragi Katua Muskogee. For translation purposes, that's Cherokee and Creek, so that you know my tribes. I'm of the Wolf Clan. My talk today is diversifying nursing, and I am an example of that because I have all those economic factors that you've been talking about today in my background, and I have had lots of assistance and all that support that we've also talked about in order to get where I'm at. I just graduated with my PhD in December. Thank you. And, you know, I was 20 when I started. I just looked this old. It just took a while. No, I went through the different levels, and I had those mentors along the way that helped me go, and we'll touch on that a little bit. And, you know, my concern is not for the people who have had the support that I've had, but for the ones who don't have it. For the people who have the aspirations in spite of the conditions and yet don't have the means and the mechanisms to move forward to get there. So this conference is great in that we're talking about those things, and we're looking at them because everything has a political background, and so we're trying to overcome those things and move past that to talk about in realistic terms about what can we do. And one more. So I'm going to touch on these and not go into them extensively because some people have already talked about them. So we have the practice of nursing care, which is the care that people have given to community members, to each other, to help increase the health of the people. And I was glad to see those slides that go back into the 18th century, because it shows that yes, we can do that, and we've done it successfully for a long, long time. That can't be, the person cannot be divorced from their community. They cannot be taken away from what they know, from their family history of the folk medicine and the homeopathic things that people do just in their everyday life to care for each other. And I think that nursing has to make a place for honoring those things, and then defining the profession of nursing as it goes to the next level in the higher education ranks. When I did recruitment and retention of American Indian students into nursing at the University of Oklahoma for most of the last decade, and what I found was when I would talk to the families and at the community activities about nursing, they were okay with nursing, except when it got to like the baccalaureate or the master's or the higher level. Then they got some hesitancy, and as I come to know them and they came to share with me, what they said was they didn't want their children going into higher education, because when they went into higher education, they lost their heart. They lost their heart for their community, like they lost their heart for their family, and it wasn't worth it. They wanted them to stay connected to their family and their community, and they saw higher education as a barrier to that in terms of what it took to get there. And having just come through that, I know exactly what they're talking about. So the face of nursing has to allow the reflection of those family connections, those community connections, and maintain that in a safe way, just much like we heard earlier about safety has to be first. And that safety has to include the ability to express who you are and how you see things without it being looked at as less than. So we have to be a reflection of the people and what they believe as well. So what helps us and what hinders us? Well, evidence-based practice helps us in that it forces us to kind of look at what in the literature works. What we have to also include, though, is that there are community-based evidence. There are culturally based evidence that we have to take into account as well, because I've worked I've had a private practice for most of the time I've been a professional nurse. After I got my master's degree, it pretty much went away when I got into my dissertation, but I've had that in my background, so I've taken care of people in the community for a long time. I had it when I worked for my tribe, and I had it in the urban area. So those things are around, and because of who I am and what I look like, I attract minority people to come to me and talk to me about the issues around their mental health and their psyche. Because someone can come to me and talk about seeing little people in the background, or they can talk about seeing blood in an egg, and what does that mean? Is somebody going to die? And they'll know that I can relate to that and not think they're crazy, and try to medicate that away from them, or try to put them in a hospital for those kinds of cultural things that bring them worry and anxiety. So it takes you have to have some level of connection with people in order to help them. And I think that we are so ingrained in the Western science model that we lose that access to the invisible, ignoring the unseen. The invisible is very much a part of who we are. I don't stand here today before you without thanking my ancestors, the guides that I have, the energies that guide and have helped me develop. Those things are all important to me, and they are acknowledged by me on a daily basis. And so when we tell people to put that away and don't consider it and don't think about it, then we're telling them that what they believe in isn't valued by us. And so when we go back to those values and those belief systems, we have to always look at what do we honor for other people, whether we believe in them or not. The institutionalized barriers have also been touched. And I have a perfect example of that. Not only have I lived it, trying to get through a doctoral program, trying to help people understand what tribes' values and beliefs are when they have no clue. And I had someone tell me, well, so they said, explain the importance of this cultural belief to the tribe. And so I'm like, okay. So I wrote it all up. It took pages. And they're like, oh, well, that's too long. I just want a paragraph. And I'm like, so that's my own personal struggle. In my family, my grandson, who is blonde-haired and blue-eyed, went to a Montessori school for kindergarten and preschool. He went to public school for first grade in Oklahoma City. 6 weeks into that, he came home and he says to me, I don't want to be Indian anymore because they're bad. People want to kill them. And I said, how do you know that? He says, that's the message he got from school 6 weeks into the first grade. So the institutionalized barriers are invisible to lots of other people, but the people pick them up when they know it's aimed at them. So those are the kinds of things that we have to constantly counter. And this is a child who's been in the sweat, who's been in ceremony from the time he could walk around. So he came home with that. And so I said, we're going to change schools. And so I've been searching for the right school for him. And finally, he's in a charter school, and it seems to be working out pretty well. But there's always that beliefs and values conflict that we have to take into consideration. So holism in nursing is part of our answer. And I've seen over the course of my career that we kind of shift out of that as we get into that Western randomized trial idea. We lose the holism, and the holism is what allows us to include these cultural things into nursing. We have it. We have what we need right in front of us. We're just not picking it up and using it. Holism values the whole person. It harnesses the unseen. We want that energy of love and compassion and caring. We name those things, but those are really part of the unseen as well. We want the connection to the cultures because we like to understand. We really want to know what's going on and would like to have that experience. Awareness of the here and now, which is what are they dealing with in everything. Sometimes it's the family member that speaks for the patient, not just the patient. And even though I was an adult with 2 children, and when I decided to go into nursing school, I wasn't that old, but I was an adult and married. When I called my parents to say, this is what I'm thinking about doing, and they said, well, you to call Martha, who was my dad's friend, and she was also an assistant dean in a college of nursing, and he said, you do what she tells you to do. So I was all ready to go to the community college because that's the way that the push is for Native students and other minorities, is to go to Native students, is to go into community colleges or to the VOTEX. And she says, no, you're going to get an undergraduate degree. So, it's all about those connections, those people who can mentor you and who can help you make the right decisions. So strengthening the community connection is vital, and I think all the things that we've talked about today is helping to do that. I think we have to go even further though, and not just be in the community to provide the care, but really know the community and make a connection with it in all the ways that allows us to be a part of that community. Care and prevention focused. That means if grandma thinks you need to wrap that in some poultice and it's not going to cause an infection that you can tell, then let them wrap that in that poultice, to support those things that people have done to take care of themselves. Collaborative practice needs to be expanded to collaborate with the community. There are community leaders out there. There are experts, elders who are experts. There are historians who are experts who know all of the different issues that have faced different communities as they struggle to survive. And those are the people that need to be included in how we practice and what we do, how we present information even. So even though many of our problems look to be systemic, I think that we still have to look at what can we do inside of ourselves. If all we can do is be more accepting, be more responsive, be a little more attentive to what we're hearing and not judging it based on what we know and what we believe and what we think, then I think that we can have a direct positive impact on that and help people overcome the barriers that they have to diversifying nursing and other workforce areas in healthcare. But until we can make that connection, I don't know that we'll be able to fully meet those goals of having an integrated and effective nursing workforce. So, is that good?